Hello and welcome to our introductory webinar on e-detailing. Pivoting to e-detailing, how to maintain connection in a virtual world. I'm Bevan Shigori, NARCAD's Communications and Education Director, and I'm excited to chat with you today about e-detailing. Our role here at NARCAD is one of the curator of content, as well as the central hub of a network for folks to chat with each other. So we're here to explore and study e-detailing together with you. Since it's a relatively new field, folks are exploring in real time and sharing what they're learning. We're here to curate those resources and tools that folks are putting together, and also we've created quite a few of our own that I'll share with you shortly. We're also here to build connections to leverage the skills that you all are gleaning from this and help those of you who are just starting out figure out where to begin, as well as support some growth as a larger academic detailing community and provide ongoing opportunities for learning and peer exchange. First, I'll give you a very quick tour of our e-detailing toolkit. If you are able to go to your browser and type in narcad.org, that's narcad.org, you will find our homepage where we have quite a few pieces of information about e-detailing. You'll see at the bottom of the homepage and explore our e-detailing toolkit link. If you click on that, you'll pop over to our e-detailing toolkit, where there's the opportunity to take a 1-minute survey to assess. We're looking to assess your needs as a program, and that way we'll be able to look at your feedback and incorporate it into some of our online offerings, which includes live webinars and also peer-to-peer learning sessions. The current e-detailing survey data from our first pass at getting folks to respond showed us that only 26% of respondents were comfortable with e-detailing, and we're looking to increase that. 34% said they were slightly comfortable, 21% were neutral, 17% were slightly uncomfortable, and 2% were uncomfortable. We want to get that up to 100% of folks being comfortable with e-detailing and even confident in carrying it out. Back on our e-detailing toolkit, after you've taken the survey, you'll see a few links at the bottom of the page that explain how to get started with e-detailing and some considerations you'll want to think about before you kick off. The first link is our e-detailing FAQs, or frequently asked questions. You're able to download this document, and here are a few highlights from it. You'll want to think about things in getting started, including what challenges you'll likely face, most common issues, what platforms you should use, how to create materials and detailing aids that are effective and engaging for use online. And we'll actually talk a little bit more about how to adapt current materials at the end of this webinar. You'll want to consider how to recruit for virtual visits. What are the different ways you can gain access, and how will those approaches differ from the in-person approach? And then we'll talk a bit about how to grow rapport virtually. How do you maintain engagement and that one-to-one interaction and connection that is so key to the original in-person model of academic detailing? You can read more about this document online. You'll also see the second link at the bottom for an e-detailing checklist we've put together. Here's a quick screenshot of page 1. You'll be able to walk through this checklist and make sure you've thought about all of the different components before you launch. There's other things on our e-detailing toolkit, which is growing and expanding on almost a daily basis based on things that we find, create, or are shared with us by you, our partners. You'll see here that there are participant tips, things that you can send to a clinician prior to a session to encourage them to enable their camera and microphone, find a well-lit space, and be prepared for interactivity. There's also an example of different e-detailing aids, as well as a few videos on how to do this kind of work, including model detail sessions. We've also been expanding our details blog to include as many pieces on e-detailing, which includes original articles as well as interviews with experts in the field. And so you'll want to check that out and see what you can find about e-detailing. When you're transitioning to e-detailing, you may think it's a whole new world, but actually there's a lot of problems that are exactly the same when you're meeting somebody in person that will translate to over the internet. And so you'll take oftentimes a very similar approach to these issues. For instance, outreach, gaining access, and scheduling. This is something that is quite challenging in person as well. When you're thinking about how to do this in e-detailing, you'll want to think about the current climate of healthcare. As of the recording of this presentation, of course, COVID-19 has had a massive impact on not just being able to see people in person, but also each individual provider's bandwidth in terms of being able to concentrate on additional meetings and appointments. So don't let that get your hopes down. If you find that it's difficult to schedule with people, you want to just keep on being persistent, or ask them if they'd prefer to be reached out to after the COVID pandemic has subsided enough for it to be safe and more breathable for folks to connect with each other. You want to make sure that your outreach method is clear and easy to engage with. We highly recommend sending a very succinct email that also has a link directly to a scheduling application that links to your calendar. You can also make sure that somebody on your team who's responsible for scheduling has sent out information that is clear and precise about what the ask is, that they understand as providers how much time they are expected to contribute to a session such as this, and that it's not a passive listening session or a pre-recorded session, but that they'll be asked questions about their individual practice needs. There will always be rescheduling challenges. You will have people who do not show up for a session or who need to reschedule and they cancel at the very last minute. This is something that happens in person too, and unfortunately it comes with the territory, but try not to be discouraged. You'll have to keep on trying to get somebody to meet with you face-to-face online. Here's another instance where a similar problem that comes up during in-person detailing will also occur in e-detailing, and where you can take a similar approach. So materials, you shouldn't have to start from scratch creating materials. The format will be different, but the content should be the same. We'll talk a little bit later in this session about how to take content that really works well in person and break it up into easily digestible portions so that providers aren't looking at quite a big deal of text all at once while listening to you. The structure of a visit will be the same order and flow. For those of you who are unsure about the structure of a visit, we highly recommend that you listen to and engage with the Introduction to AD webinar prior to diving into e-detailing. Clinician engagement will be just as challenging, and for some of the same reasons, you'll find that clinicians do become distracted and that that's par for the course. Communications distraction will always come up, whether it's via email that shows up while you're on the session, a physician's pager, cell phone, or a knock on the door. This is something that all you need to do to respond to is to be patient, and if it's a significant distraction or takes away a significant amount of time from the session, you can simply ask, are you able to participate right now, or would it be better for us to reschedule? You'll also find that the same issues related to distractions from folks who need to kind of vent or share a personal story may happen. Find the right balance between allowing folks to share a bit of who they are and then refocusing on the issue at hand. You'll also want to connect with a provider to understand the ways in which COVID-19 or other health crises have impacted their day-to-day operations and their approach to patient care. So you'll want to figure that out before you dive into the e-detailing content itself. We'll talk a little bit more about that in just a moment. Just like with in-person, you may find when you show up that less time is available than was scheduled. You may show up right at 12 o'clock for a 12 to 12:30 session and find out that the clinician is only available until 12:15. The response to this in person and the response to this online should be consistent, where you say, since we only have 15 minutes, I could talk about A, B, or C, which is most important to you. Rather than taking the full visit and condensing it to 15 minutes, you should just try to breathably address what you can and then schedule follow-up time while you have the clinician online. There are some adaptations you will take across every step of the visit, and we'll break them down in more detail momentarily. But across most steps, you'll want to consider body language, including your own. You'll want to consider that a clinician can't see all of your body language. So right now you can see me from about the shoulders up. If I lift my hands and move them around, you've got a little bit more of a sense of how I'm expressing myself. But you can't see, am I leaning forward or back as clearly as you could in person. You can't see if my legs are crossed, if I'm tapping my foot. So make sure that the real estate you have on screen is being utilized. Use your hands when you can. Make sure you're using clear eye contact. Lean in demonstrably when somebody is sharing with you, and so forth. You'll want to make sure you're modulating your voice to make sure that certain key points are emphasized clearly. So try to put a little bit of life into your voice and ensure that it does not sound like you're just sort of reading off of the slides. Here are a few tips. When you're trying to practice your body language and tone, you can practice it on Zoom with a colleague just to get a sense of immediate reflections of how you come across online. You can also record yourself practicing phrases via either video or audio and then play them back to review your voice modulation, your facial expressions, and your body language. Now let's look at the clinician's body language. You're also less able to see their body language just as they're less able to see your full body. So you'll want to ask additional check-in questions early and often, saying things like, does this make sense so far? Should we pause for a second? Is this what you've seen in your practice? Let me know if I'm going at a good pace, if I'm going too slow, too fast, if you'd like me to skip to the next slide. Don't be polite. Just raise your finger or type in the chat box or just, come right in and tell me verbally that you'd like to move on. You'll always want to use reflective questions and statements. Let's say, for instance, that a clinician seems bored or disengaged. Maybe they're leaning back, kind of looking away from the screen, checking their phone. Open-ended prompts to re-engage are going to be really important. Saying something such as, I'm really getting the sense you've heard this before and that this isn't new to you. Should we move forward? Or can you tell me what the most challenging thing for you around this has been? Or, it seems like you're an expert on this. What are the nuggets you would want me to share with a brand new clinician about this topic area or this challenge? Always asking open-ended prompts is the way to get folks engaged. If you say, does this make sense, when someone is looking off to the side and they say, yep, you're not going to be able to re-engage. But if you say, can you tell me about your experience using this tool, prescribing this medication, using this screening approach? They'll likely re-engage. You can always offer them a magic wand approach. If I could wave a magic wand and give you anything you needed resource-wise to make this topic easier to deal with your patients who are experiencing these issues, what would it look like? Those are just a few examples as related to reconnecting, but we'll walk through now each step of a visit, from introduction to needs assessment, the delivery of key messages and their corresponding features and benefits, handling the objections that will most likely come up from a clinician who's engaged with you and wants to know more about how to implement these key messages, the summary of your visit, and then the close and the ask for a commitment to something specific and measurable. Let's look at the introduction. This will be pretty similar, but what you'll want to do when you're adapting is acknowledge the circumstances that have created this opportunity to meet each other online. You'll want to say something like, I know this is a crazy time right now and that COVID-19 has really made things challenging. Can you talk to me a little bit more about what that's been like for you? You also should consider acknowledging the awkwardness of e-detailing in virtual platforms. You will start speaking over one another. There will be potential glitches and technical challenges. Saying up front, I know this isn't ideal, but I'm really appreciative that you're joining me. I know that sometimes we'll have a couple of flow issues, and in that instance, we will figure it out, and I'm sure we'll be able to connect. Opportunities that arise from e-detailing that you might not learn in person is learning about the clinician's learning styles when being online. We'll talk a minute about that in just a minute on the needs assessment slide. Sharing screens to present your program is also something that creates an opportunity. You can ask a clinician to share a screen of a tool that they're using, some programs or some studies they find interesting. So it does allow you to kind of move into the clinician's virtual world a bit more smoothly than it would in person. Okay, let's look at step 2, needs assessment. Some considerations you'll want to approach relate to what I just said about acknowledging the situations that force us into approaching this from an e-detailing perspective exclusively. And for those of you who've been doing some sort of e-detailing prior to COVID-19, you may want to acknowledge something such as, I know you're at a really rural practice and I appreciate you meeting with me today. What have been some of the challenges of being remote, and how are you able to see your patients who don't have access to transportation? So you want to remember that for successful encounters online, you want to make sure that your clinician is engaging early and often. So try to avoid the desire to present too much information at once or to lapse into a lecture. An e-detailing session should not be what I'm doing to you as a viewer right now, which is essentially lecturing and presenting. This is not academic detailing. It's really critical to make sure you focus on a dialogue versus a didactic presentation. And you want to make sure to be asking good needs assessment questions right from the beginning. And doing so allows you to really be engaged on a level that's a little bit different from in person, but not necessarily less. So using your chat box to demonstrate your active listening is something that can really help. If a clinician is sharing a story, experience, or challenge, and you're listening and showing that you're doing so by perhaps nodding, but they're also seeing a list of what they're sharing in the chat box. So for instance, challenges with OUD referrals, patients who do not show up or adhere to medication, they're able to see what you're tracking, and it also keeps them and you focused for the next follow-up step in the conversation. You can also, as I mentioned before, invite your clinician to share any sort of resource that he, she, or they finds critical to how they're approaching something. Or in the instance where they say, I have a process that we use here at the clinic, but I don't really like it. Saying, can you show me why you don't like it? Maybe you could share your screen and show me something that doesn't provide any HIPAA protected patient information, but can show me a workflow that you go through or an app that you use. So these, again, are some ways that you can engage. Always asking questions, making sure that you take good notes and show those notes via the chat box, and asking them to share their screen are all opportunities for e-detailing. All right, let's consider key messages, features, and benefits. If the prior steps we just talked about, which were the introduction and the needs assessment portion, are well executed, then this segment will require, we'll have a smooth transition, but will require a little more of you sharing some information. You want to make sure you find that balance and that you're pausing to ensure that the clinician's with you, and that you're on the right track with them. Don't go too far without asking, how does this sound? Am I going in the right direction? Because then they can step in and say, you know, I was actually a little more concerned with figuring out some scripting tools I could use to talk to my patients about opioid use disorder, rather than figuring out what treatment options in the area are available to them. That's just one example. Always encourage the use of the platform tools for you to be interrupted. Some people are too polite to interrupt you verbally, but asking them to click the raise hand button might be something they're more comfortable with to get you to take a pause. You can also ask them to just go like this whenever you want them to engage and they don't want to interrupt you. There are some opportunities here when you're delivering key messages, features, and benefits that come exclusively from being online with your provider. And one of those is using your materials that you'll be showing online to have a few live pieces, some interactive pieces. For instance, showing a risk calculator and asking them, by sharing the screen and allowing them access to your screen, to go ahead and try to use that risk calculator and see what they do and don't like about it in real time. There's also the opportunity to break a detailing aid that you might hand to somebody in person and they may be overwhelmed by all of the content, into small digestible chunks, like I mentioned before. And again, we'll give you an example of how to do that with a campaign from colleagues of ours. There's also pros and cons, of course, to slideshows, and we'll talk a little bit more about that in the next couple slides. But you want to make sure that you pause, ask them to raise their hand when they can, and that you're giving them digestible chunks. When in doubt, ask a question. All right, now handling objections. This is usually one of the juiciest and most a space during a meeting with a clinician where you'll need to be able to pivot and be the most flexible. So considerations include that you're going to have to ask directly a little more when you're online than in person what the challenges would be with implementing a key message. So instead of saying, we'd really like you to complete a full sexual health history by using this validated questionnaire that's been studied and tested. How do you feel about that? Instead saying, do you foresee any challenges in implementing the use of a sexual health questionnaire such as this one? So be specific and ask, what do they see as being potential roadblocks? You'll have to elicit those objections because this format can make them feel more like they'll just nod and move on. So do remember that it's up to you to engage and get that feedback from them. You can ask questions like I just shared, or this one, for instance, in this third bullet. Is this something you could see yourself doing? Why or why not? And if they say no, learning from why not, and then pivoting to figure out how you can help them with what they say they need. Again, the opportunity here is that shared screen. They can show you, well, I like this questionnaire, but it won't fit into my workflow. Let me show you exactly what I have to do when I'm using Epic or some other EHR. Detailers can also respond to a barrier by asking clinicians to show a tool they'd prefer to use. So they may say, I already use this sexual health history questionnaire, and show it to you in real time. And then you can both walk through it and compare it to the one that you'd like them to use and ask them what the differences are and learn more from there. So again, some highlights. You want to be direct, meet them where they're at, and try to shift your perspective if they share for you why something won't work. Here are some considerations and adaptations to your summary and closing. Your summary has to be clear and succinct. If you talk too much at the end, you may lose the clinician towards the end of the visit when they're ready to transition to their next appointment, to lunch, or just to end the session. So make sure that your summary and closing are less than 60 seconds long. Make sure you ask the clinician after you've summarized what you've discussed, does this sound accurate to you? Am I missing anything? Closing and making the ask really clearly and directly is super important in this format, even more than in person. You'll want to say, can I get you to try to use this sexual health history questionnaire for the next 3 patients that you see? Follow up with you within a week of those last 3 patients being seen and ask you how it went. The opportunities when using an e-platform here are also very specific to being able to use the features of a program such as Zoom. You can include a chat box review of highlights from the discussion. So while you're summarizing, you could say, we started chatting about opioid use disorder. You shared that a large portion of your patients seem to have it, but you're unsure as to what sort of screening tool to use. And these pieces will pop up in the chat box. Challenges with patients who may have OUD, unsure what screening tools to use, etc. That's really helpful for the clinicians that you'll be meeting who are visual learners. Also, detailers, you can send follow-up information directly via chat box. You can send links. You can show website resources by sharing your screen. And you can also ask the clinician themselves to type in any resources or follow-up questions they may have. So again, here's our highlights. You want to be succinct. You want to make the ask and make it clear, measurable, and specific. And you want to make sure you follow up. Let's talk a little bit about when to send materials. The long story short is you'll want to go with your instinct about what is most helpful. You can send materials in advance. You'll want to consider the video versus platform perspective. If you're just meeting with somebody on the phone because they don't have access to video, you'll definitely want to send the materials you'd like them to look at in advance. It'll be harder to do it via phone, but you'll be able to try it by saying, I'm on page 2 in the bottom left-hand corner. Do you see the risk calculator snapshot that's down there? Things like that. You'll want to consider time constraints. So thinking about how much time there is between you scheduling an appointment with a clinician and the actual appointment occurring. If it's 2 weeks, sure, you can consider sending information in advance. If it's in the next day, you may want to just wait and share it with them in person because they'll be unlikely to have the time to read it. And by in person, I mean in real time. Thinking about how much time in the actual visit you'll have will also help you figure out if you want to send materials in advance. For instance, if you know you have a half an hour, then you might want to reveal your materials in real time and walk that clinician through them. If you know you only have 15 minutes, then you may want to send them in advance with a note that says, if you'd like to take a peek at these up front, then we'll be able to dive more into the conversation. It's very much up to you. Don't forget that less time means you'll send them in advance, and that more time means you can chat about it. A few more considerations about sending materials. You want to consider that the online platform makes it really challenging for folks who are visual learners and like to read content to be able to read online and look at the materials and key messages while you're talking. For many people, it's difficult to multitask like that. You can ask them when you do your outreach, what would you prefer? I have some materials I'm planning on going through. Would you like to read them in advance, or are you more comfortable going with the flow and looking at them together in real time? Most clinicians will know, and they'll tell you. Here's some opportunities when you send ahead. Again, clinicians will have a sense of what you'll be discussing. They will have reviewed some of the data and evidence if they have the time. And again, real-time learning and reading for the first time can slow down your discussion, and it can also trip up those people who have an inability to effectively multitask and follow the discussion. The challenges, of course, are if clinicians have already read the materials, they may walk right into that meeting with preconceived objections that they've thought about for more time. So you'll just have to be ready for those. A clinician may also cancel the visit. Looking at the materials without the context of an real-time conversation may allow them to look at those materials without the context of the conversation and determine, I don't really need to meet with this person, or this is all new information, but I don't think I'll use it. So consider that as well. There may be a sense that a clinician feels like the pre-reading is homework and just one more thing they have to do. So you'll want to make sure that if you send something in advance, that you communicate via email. This is totally optional reading, just something I thought you might like. There's no pressure to read it in advance of our meeting. Let's talk a little bit more and dive into what e-detailing materials look like and how you can use them successfully. So you want to make sure that they're supporting an interactive conversation. They can be brochures or detailing aids, reference cards or pocket cards, risk calculators or links to use risk calculators, checklists or other office workflow tools, and also any other patient tools that clinicians can use, like scripts, as well as links to campaigns or toolkits. Don't forget, they're not going to be stacks of articles that you show on your PowerPoint. If you have articles and literature you want to share or that are requested of you, you should send those as separate links versus showing the text on your PowerPoint. So strong, well-designed materials, they clarify complex info. They should be customized to meet the needs of a clinician. And by that, we mean you should be able to move around a slide deck of materials relatively quickly and seamlessly, and know what the order of all those slides are, so that if someone says, oh, I understand the science between X, I really want to know more what to do about Y, then you're not shuffling through your slides. You're able to say, that's on slide 12, here we go. You want to make sure the materials don't replace your conversation, that they're helping that clinician and yourself engage with each other, but that they're not the focus of the presentation, the way that they are here in this presentation that I'm giving to you right now. Here's something we really emphasize with e-detailing. In traditional in-person detailing visits, there's the needs assessment, where you ask the clinician how they're doing and talk to them about the clinical topic at hand, asking them an open-ended question about how they've either interacted with that content, what they've seen with their patients, etc. With e-detailing, again, there's the acknowledgement of the awkwardness of trying to have an in-person conversation over the web, but then there's also recognizing, again, what are those issues that have made us have to use this platform. So typically you're asking questions in person about the practice and the clinical topic, where the clinical realities are the focus, right? So tell me about your last visit with a patient with chronic pain. What's the top challenge that you're having when you're supporting your patients with best practices in HIV prevention? What are some tools you wish you had dealing with patients with type 2 diabetes, etc. With e-detailing, you'll start with a learning style needs assessment about preferred engagement style, saying things like, okay, so I realize we're on an e-detailing platform and it's not as cozy as in person, but I just want to get a sense of how comfortable you are with it. Have you been Zooming a lot? Where's your comfort level? Then you'll want to dive into what's coming up for them in terms of any current health care landscape issues. How has COVID-19 impacted your practice? How do you feel about online learning? What do you like best? What do you like least? Are you more of a visual learner, more auditory? Do you prefer to be hands-on? How is moving to an e-learning platform either ideal or suboptimal for you? And you can think about other questions you can ask to make sure that clinicians feel like you're not just dive bombing right into the clinical topic, but that you're getting a sense of who they are, how they learn, and what's important to them up front. Now we're going to talk a little bit about adapting materials for online learning. You can work with what you have, or you can share other materials that some of our colleagues have made, and you can check those out in our materials toolkit at narcad.org. Try to make simple changes if you already have campaign materials that were made for in-person visits. Don't reinvent the wheel. Just take what you have and break it into bite-sized chunks. You can always ask for support from those who are tech savvy and have graphic design experience. We also highly recommend that you invest some time in tutorials on free graphics programs like Piktochart, or Canva. You can also reach out to local design schools to see if there are undergraduate or graduate students who are working to build a portfolio and may be willing to create some materials for you for low or no cost. If you don't have campaign materials yet, as I just mentioned, you can check out our materials toolkit. That's under our Learning Center at narcad.org. You can also check things out as organized by clinical topic at our detailing directory. All right, so let's look at an example. This is a fabulous Proud to be Prepped campaign by the Colorado Department of Health, Public Health and Environment. And you'll see that this is the cover page of a 4-pager that we call a detailing aid. It's a synthesis of data with specific key messages that are being asked of a provider, and it helps enhance the conversation. The challenge with this is, if I just take a screenshot of what was used in person, it's too tiny to see. I find myself squinting. I find way too much information being shown at once. And it would be close to impossible to feel able, if I were a provider, to read this, understand it, and listen to somebody ask me questions or feel like I'm able to engage in a conversation in real time. So we're seeing a lot of different content here. We're seeing statistics. We're seeing asks to implement some key messages. We're looking at information about sexual histories, baseline assessments. It's all too much. There's also 2 more pages with information on testing, resources, prescribing, and frequently asked questions. So let's look at what are the key elements to include in general in a detailing aid. You want to make sure you've got current relevant data, things that can be visually absorbed through charts and graphs, potentially myths versus facts, and images that convey relationships. Your key messages can be right on your document and should be using action-based words like try prescribing PrEP or use X tool. And that's where the how to implement those messages information should support those key messages. You can share algorithms, references, contact info, links to additional content, and other tools and resources, as well as making sure you credit wherever the data came from, not just through resources, but also any funder sponsorship or partnership logos. You want to remember that what we just looked at a moment ago was too dense. So we want to make sure that any data we have, we're breaking it into chunks that we can easily understand. So your key rule is less is more, especially online. Don't overwhelm your reader with too many statistics. You can always share more after, but if you provide too much, you can't take away the excess. You want to ask yourself when you're creating slides that take your campaign materials and translate them, how can I illustrate this issue with the most direct content? Sometimes putting 6 statistics that might drive home a point is too much, and choosing 2 that are the most engaging, the best worded, and the most likely to make an impact and illustrate your point is a better approach. You also always want to remember how to encourage interactivity, like using linked risk calculators, as we talked about before. Again, less is more. Word economy is something you really need to make sure you're considering. Real estate is precious, but overloading will overwhelm. So break up your text with images and use less text. You also want to consider the images that you use are accurately representing diversity and reality, and making sure that they don't perpetuate stereotypes. Whenever you're getting stock images, make sure they're free or that you can afford the royalties. Always check royalty information. All right, so you're starting to either build your content thinking about this process or adapt your content. You want to field test with others through an e-detailing platform. So hop on a Zoom with colleagues either within your program, other clinicians or healthcare professionals you trust, or external contacts who might not know about the clinical topic or be in the healthcare profession, but can offer you feedback for what's visually engaging, what's too much information, and in general, how things appear. You'll ask your field testers, is this clear? Why or why not? Is it engaging? Why or why not? Is there anything missing? And what would you change if you could? And then you'll want to practice. After you get that field testing information back and you get a sense of whether or not you have the content you want, you'll do a live practice run to see how well prepared you are to toggle between those content pieces like we talked about a little bit earlier in this deck. Pause when you practice and make notes as you go. Put them into your PowerPoint notes section so that when you're in presenter mode, you can see that while you're on slide 38, it says, don't forget to share this link. Don't forget that if they ask more about this portion of this slide, you'll want to go back to slide 16, things like that. Keep practicing until you're comfortable, but know that you're not, again, ever delivering a lecture or a static presentation. You'll need to be able to think on your feet. If you're not sure if you're ready, do a recording session. It's sometimes painful to see yourself in real time, but doing a record and playback can offer you so much information about what's going well and what you need to change. So you'll want to consider a few other tips and reminders as we prepare to wrap up today. Make sure you have a follow-up email to that provider ready to go. You'll have a template you'll want to use that follows up, and then you'll want to pop in the specific commitment that you asked for that was agreed upon and the follow-up time you agreed upon into the email. Send your email immediately after the visit, and make sure you're sharing attachments of any of the detailing slides that you used, any other materials you'd like to incorporate, and anything that was requested. You'll want to share links at the end of your session via chat box and email for easy forwarding to clinicians' colleagues. So don't be afraid to write in a follow-up email, "It was great chatting with you today." And then you're sharing what the commitment was and the time frame, and saying, feel free to share the slides we went over today with any of your interested colleagues. And please share the calendar link at the bottom of my email so that they can sign up for a session if they'd like. All right, we're gonna go back to our example of the PrEP campaign and look at it for just one more moment. So this is too dense. We're gonna zoom in here. The first thing we want to do is figure out how can we break down this front page. So this is just an example. The first thing we'll consider is, okay, here's the campaign title and what we generally want to accomplish. Let's take a screenshot of that and break it down. So this is what a slide could look like that I might, as a detailer, show a provider, and it looks pretty clear. All right, let's try another one. What is PrEP? Okay, let's make that bigger and see what happens. I'm going to screenshot that and put it into its own slide. But here's the problem. It's pixelated because it was so small in the original document that a screenshot really makes it look hard to read. You can either ask your designer for the original files and ask for their support in making that larger or using a higher resolution file, or you can transpose it and try to make it look as close to the original as possible by using some of the basic text options on PowerPoint. So here's what we did when we tried to do the latter. Pretty close. Not perfect, but as long as your campaign team and your program team agrees that this is acceptable, you can always translate things by just using what's available on PowerPoint. Some tools will be much easier to adapt than others. Here's an example of a patient-facing prescription pad for pain care. It's a non-prescription. This is the front and back. And it's something that's offered to patients who say they want an opioid, but a provider feels that it's not necessary. And yet the provider knows that the patient wants to walk away with some sort of tangible follow-up tool. So I'm looking at this and I feel like this is a great tool, but again, it's too small and I can't see it. This will be easier to adapt. You can literally break the front onto one slide and walk through it with a provider and the back onto another slide. So you'll want to make sure prior to any of your sessions, you've really thought carefully about all of your material translation or recreation, tested it on people to make sure what you think is happening and what you think is clear is actually clear. And again, that practice is going to be critical to your success. You'll need to practice even more than you would for an in-person visit and to remind yourself technical glitches do happen and not to panic. If you don't practice, your credibility can be undermined. And you also don't want to have to rely on your materials. If for whatever reason you can only have audio and your materials can't be accessed, or a clinician says, you know what, I'm in transit and I can't look at the materials, you want to be able to know your materials so well that you can describe exactly what's on each page. But you also want to make sure you're not so reliant on your materials that you're turning what should be interactive into a lecture. Again, a reminder to pause and ask questions early and often, being ready to refer to the evidence that supports each key message that you are sharing with a clinician. This is a lot of information to take in. We're happy to answer questions at narcad@partners.org, but here's our final slide to give you a few things to remember. The first thing is it's going to take time for you to do all of this, especially to adapt or build your materials for an online platform. And don't forget that just like in person, every single visit will be unique. Mastering the e-detailing approach is really about having that balance of clinical knowledge, campaign knowledge, but also being able to be truly present so that if a clinician throws you a curveball, and they very likely will, you're able to pivot without panic. Strong and immediate follow-up is even more critical. You want to make sure to maintain that relationship, and so you'll need to follow up on what you said you'd follow up on within a reasonable time frame. Don't forget that clinicians are doing more and more telehealth visits with their own patients themselves. So a lot of folks are actually way more tech savvy than you might think and more comfortable with Zoom than you might think. Many of them understand the challenges of e-platforms and virtual communication. And don't forget, a successful e-visit will look different than an in-person visit. Getting through your material and setting up a follow-up visit is definitely a success, even if you didn't have the time to ask a clinician to commit to a specific change in practice. Just starting to build the relationship is a win. And again, it will take longer to build the relationship this way. So have patience and make sure you build in a comfortable time frame for you and your teammates. Thanks for joining us today for our NARCAD e-detailing community of practice overview webinar on e-detailing. Again, please visit us at narcad.org, as well as emailing us at narcad@partners.org with any questions you might have. We hope you're watching this as part of a pre-read or preview to a training that we'll be able to hold either virtually or in person soon. Again, with questions, reach out to us at narcad@partners.org, and we'll see you soon.